Hello, HBSE online class, HBSE 1 online class. I'm Heather. You've already seen my face, I believe. I talked about the syllabus. I just wanted to go over the PowerPoint. That's the PowerPoints that are up for this week, just so you can sort of hear my voice and I can elaborate on some of what I have as sort of key points to focus on in the chapter. This semester we'll be focusing on infancy through adolescence. So we're going to cover pregnancy, infancy, childhood, adolescence, that from a biological, psychological, social perspective. So you'll notice that each of the chapters are broken down into biopsychosocial. And there's an emphasis on sort of ethnocentrism and racism, how ethnocentrism is believing that your ethnicity is superior to other ethnicities. Racism will obviously when there's the thought that one race is better than the other. We'll also be looking at sort of gender roles and sexism as a part of this part of the book. Make sure you understand the main assignments. There's assignment guides up. A lot of you have questions about the discussion board, and I think all that stuff's really hard. We'll get into a rhythm. But in terms of group, I expect you guys to talk to each other as a group. You can do that by phone. You can do it by chat. I really want you to be able to hear each other's voices. It's even better if you can hear each other's voices and see each other's faces. But I don't want to see the discussion on Blackboard. I just want to see a summary. And in that summary, the responsibility for posting that needs to change with the group members. So I can pretty well follow that for full participation in the class. Make sure you're reading. It's really text-based, so make sure you're reading. There's films involved too, which making sure you see the films. There's papers and other activities involved with that, so you won't be able to do that. Some of you, I already went over that with the syllabus. I won't go over it again. You guys are doing a good job of asking me questions, which is great. It's important to connect with your classmates, so I didn't want an online class to get away from that. You guys, the social work program is a very challenging one, making connections so that you can help each other out when you need to, but also once you graduate, these will be the folks that will have jobs in the community that will help you get jobs. So it's important to come across as a professional and kind in this class, because these are folks that could hire you in the future. So reading, this is a lot of reading, I guess. I have some tips on how to read, skimming through the chapters, looking at the main sort of chapter headings so that you get a sense of what the book's about. If you have any problems with any part of the chapter, especially when you guys are doing activities around the chapters, just asking me so that I can help, or looking up things on your own. So I've put up some tips on how to think about reading through. I don't know how often we talk about that. If you guys decide to go on and get your master's degree, realize you're going to have even more reading, and so you have to learn how to read efficiently so that you can actually get a lot of reading done in a short period of time. The program, all BSW programs in the United States are generalist programs, which means that you learn how to analyze problems and social problems from a micro, like individual interaction between individuals or small groups. Meso, which is more on an agency level intervention, so if how to provide services, and then on macro level is more on a community or state, federal level. That micro, meso, macro is going to come up a lot in this class because I'm going to have you guys analyze things from those levels of understanding. Theory. This whole book is really about theory, and you guys are going to, developmental theory is super important to your licensure exam. So again, reading and studying this book will help you with your licensure exam, but it also helps to give you an idea of if your clients and families are fitting into norms. That doesn't necessarily mean that something's wrong. It just means that they might be falling outside and having to live with the pressures of falling outside sort of what we decide at given times is normal development, right? So social care practice is a model that really I try to use, that's where you really think critically about what is being said about development. It's influenced by feminist theory, which is that to think about the political as, or personal as political. So the categories that kids get put in, that is often based on the larger economic structure. So, for instance, people of lower socioeconomic backgrounds and who are African American are more likely in this country to be diagnosed with schizophrenia, right? So, how much of that is actually that those folks have that diagnosis, or that there's a more likelihood that professionals will give them that diagnosis? So, really, it's trying to think and be thoughtful of why we're learning these theories and how they're helpful and how they might not be helpful to working with your clients. The cultural approach to developmental theory means that I'm helping you guys look at sort of stereotypes and media representations that we all are influenced by, and how that has us decide what is normal, what is abnormal, what is good, what is bad. And then this class, I'm hoping for it to be a brave space, not a safe space necessarily. That means that hopefully, as you guys work together in small groups and in partnerships, you can very respectfully share different perspectives and not judge each other for those different perspectives. We all come with lived experience, a worldview that is different, and so there's something that all of us have to add to the conversation that might be unique from everyone else. Okay. And so the questions to keep in mind that I have on the slides are really just the same things I've just been talking about. Thinking about things in context. So the education, the EPAs, or the competencies that you guys probably have been talking about in other classes, these are the things that CSWE, which is the Council for Social Education, has said that we need to make sure you can demonstrate by the time you graduate from an accredited program. So that's making sure you can identify what it means to be a professional, how you can ethically engage with diversity and difference, people that are different from yourself, that you're aware of how to engage in advancing human rights and in promoting social and economic justice, that you engage in research, so you look at what the research says about what you should be doing with your clients, but also that you're involved in a conversation with researchers about your own practice as a social worker. Policy practice means that you're aware of what policies influence the work that you do, and then if those are discriminatory, that you work to change them. That you understand the helping relationship, so engaging with your clients, communities, groups, assessing what's going on, deciding on interventions, monitoring if those interventions are helpful, and then evaluating. So hopefully you'll be getting used to that helping relationship piece. You guys are already turning in your introductions, so I'm not worried about that. I have some information about my career as a social worker on here. Where did I put it? So I don't have a bachelor's degree in social work. You guys are working towards that, but I don't have that. I have a bachelor's in psychology from William & Mary in Virginia. and I minored in biology. I went at that time, and you guys have the opportunity for this as well. I was involved in summer camps. Summer camps are really good for working with young people, but also I worked with adults with disabilities, and so I decided through those camps if whether I wanted to be a social worker or not, and work with people closely. I also worked at a post-acute brain injury rehabilitation center in Manassas, Virginia, and so I worked with people who had brain injuries to try to find to recover from some of that, but also help their family figure out how to care for them when they returned home. Then I went back and got my master's degree at Virginia Commonwealth University in Richmond, Virginia, and it wasn't a generalist program, so I actually specialized in healthcare and more on micro, sort of engaging with individuals and groups. My first year placement was at a street center for the homeless in Richmond called the Daily Planet, which was named by the clients, and really newly homeless people, trying to set them up with resources, mostly men. And at that time, a lot of the young men I were working with were aging out of the foster care system, which is still a problem today. In my second year in my master's program, I worked in the surgical ICU at the Medical College of Virginia, and also with vascular surgeons and ear, nose, and throat surgeons, mostly working on mouth and throat cancer and people that had new amputations. So that's what I did there. And then I went back to the brain injury rehab and worked there for a while as a discharge planner. And then worked at my hometown hospital in the critical care and in the sort of progressive care unit, mostly working with people who had breathing issues like congestive heart failure, emphysema, things like that, lung cancer, and then also people that had critical diagnoses. Yep. Then I moved to Ohio and actually worked in Gibsonburg, Ohio, at a nursing home there, and worked on discharge planning for the skilled part, and also helped the residents who had any kind of mental health issue while they were residents of the nursing home. I also worked for the Area Office on Aging as a case manager in Toledo, which I loved, getting to go out into people's homes and helping set up services so they could stay in their home and not go to a nursing home. And then I moved to Illinois, and I was the director of a respite program for families who were caring for loved ones with dementia. So I worked with the University of Illinois there to train college-age volunteers to provide respite. And then I worked at the hospital there at University of Illinois, Champaign-Urbana. There's two hospital systems there, but I worked for one called Carl. And I worked in the adult critical care, the rehab, but the majority of the time was in perinatal medicine, which is high-risk pregnancy, the neonatal intensive care unit. And this is the setting where I spent most of my career. While I was there, I started a program to provide extra education for adolescent mothers while they were pregnant, and I connected them with college-age mentors so that they could get the education they deserved, so we could prevent preterm labor and the babies could make it to term. Then I returned to Ohio, did some case management for the Lucas County Board of Developmental Disability. This is a volunteer coordinator for the Historical Museum in Bowling Green, which is actually a poor farm. And I taught about social welfare history there. And then I've been an adjunct and a professor since then. I've also worked a little bit as a in an EAP, which is an employee assistance program, providing private sort of counseling for people. So that's quite a lot. And some of that was because I moved around. But there's a lot that you can do in social work. That's probably what I want you to know. Last but not least, you guys have... social workers are known for strengths perspective, empowering people, and emphasizing resilience. How people are able to cope with the bad things that go on in their life, and going back to those moments and talking to them about what they have done. And one of your activities is around that. How do you assess for strengths? How do you look for strengths? And I think that can be challenging sometimes because you don't always have a friendly relationship with your clients, especially if you're working in settings where they're mandated to come see you. So you have to think of, well, what about them is strong? What about them will help them get through what they're needing to get through? And I think I asked you guys some questions about what you think barriers to a good assessment might be. And I look forward to seeing what your answers are. It's important to always think of alternatives. So there's not one right way. There are usually multiple right ways to help someone. There's ways we prefer as clinicians or we prefer as social workers, but that doesn't mean it necessarily fits our client. So we have to be careful that we don't limit ourselves to just a couple interventions. And just to remind you what resilience is, I know some of you haven't gotten your book quite yet. Resilience is the ability of an individual, family, group, organization, or community to recover from adversity and resume functioning even when suffering serious trouble, confusion, or hardship. So it's when a person survives despite difficulty. Okay. That's really, I just wanted to cover those things a little more thoroughly for you guys. Okay, bye.